We have been doing a lot of work over the years of trying to understand what conditions are necessary in NHS organisations to ensure the delivery of high quality, continually improving and compassionate care for patients and service users. And we've identified what the key cultural elements are in those organisations that deliver high care. And from that, we've developed an assessment tool, a questionnaire, if you like, that asks staff to rate their cultures along the key dimensions that we know are associated with high quality care. So over 1,500 staff responded to the questionnaire from all care groups, from all localities and all staff groups. So it's given us a really good, quite reliable picture of how staff see the organisation in relation to the key dimensions we're looking at, which are the clarity of the vision of the organisation in relation to delivering high quality care, the ability of staff to, if you like, live the values of the NHS Constitution, the extent to which staff are clear about their roles and are getting good feedback on their performance, the extent of the supportiveness and positivity and compassion within the organisation, how good the learning and innovation and quality improvement is, quality of team working, and the extent to which there's collective leadership rather than hierarchical command and control leadership. Well, it seems to me really fundamentally important for an organisation to go through this process. We know that those cultural dimensions that I described are what characterises NHS organisations that deliver high quality, continually improving and compassionate care. So if you really want to ensure that the organisation is doing the best it can for patients, then it's important to know what the culture is. And then you can see where the dark spots and light spots are, where the strengths and weaknesses are, and begin to reinforce the strengths, to spread good practice, but also to focus on the dark spots and say, how can we support those areas or those staff groups or those care groups so that they are equivalent to the best within the organisation and indeed the best in other organisations as well. So it's a really important process, and it's one which of course can be repeated so that the organisation can see how it's improving. Whenever we do an exercise like this in an organisation, it's absolutely vital that the staff see that when they take the time to complete a questionnaire or a survey, that there are positive consequences, that changes occur as a result. I think that will happen in County Durham and Darlington, and it's something we're encouraging across the whole of the NHS to take the data and make improvements, whether it's from the culture assessment tool we've used here or from the National Staff Survey, so that we can continue to improve how these organisations function in order to deliver continually improving and high quality and compassionate care for patients. What's important in terms of the top line findings are the level of compassion that's shown towards patients. Staff generally agree that this is a compassionate organisation, and that seems to me the core value. And that's great, there's good teamwork, there are areas for improvement. Although staff are clear about their roles, they're very often not getting sufficient data that tells them how well they're doing. They're not so clear about the overall direction of the organisation, and there's a sense that they could have better managers and leaders in terms of giving more support and listening to staff and making sure that managers and leaders are providing the support and the resources that enable them to do their jobs. Having said that, what we also see is that the County Durham and Darlington NHS Trust is improving year on year, and the staff survey results also give an indication of a trust that's in a positive state and getting better. So that's really encouraging.